systems. I know that in certain countries there are a number of different islands, and some of the most distant islands are of particular concern. So we need to also focus on service provision in these regions. These may be mobile services, so that each island has access to health services and thereby improve universal coverage. So these countries will be a priority, but we will have a specific approach tailored to their specific needs, whether this be provision of services or also thanks to the technical support of the different health ministries. Thank you. I thank you.
I shall now give the floor to South Africa to ask the question.
pamono tutega. Pamono pamono basi. Vitu gaya kuno kule basi. Ya bwino. Ya bwino.
Déjà connecté, ou si tu voulais connecter, tu dois te renommer. Tu dis connecté avec quel nom? Pardon? Non, je dis, c'est quel nom que tu as? C'est quel nom?
For the minister only or the three of them? Send it to the three of them. Okay, then you and then you for the minister. Just for the minister because he just sent me a WhatsApp.
Okay. D'accord, je vais te promouvoir en tant que panéliste, ok, et puis je vais demander à Naomi qui puisse te renommer.
Yeah, we are renaming because it should be the name of the candidate on the screen. So we are doing it here. I think now you've been promoted. This guy is calling you, but I'm calling him, he's not answering. When I'm calling him, he's not answering. But he wants to call me, and he's disturbing me.
Oui, je l'ai fait exprès comme ça, ils ont l'attitude d'ouvrir leur micro, ainsi de suite. Parce que souvent après. En panéliste, ils peuvent pas? Si en panéliste, parce que souvent ce que je fais, c'est que je mets que tout le monde ne puisse pas ouvrir son micro pour la séance commerciale. Sauf les co-hosts qui ont ce point-là qui peuvent dire. Yes, on which page it's not appearing? French. Is it the French or the English? No, the French is normal. Forget about it. No, forget the J. Yes, Pamela, one second. Just for the French channel, you just on YouTube.
Yes, French, English, Portuguese. It will take you to your trip.
Do it. Non, bon, demandez aussi ils nous le sont. Voilà, c'est la caméra là. C'est votre image.
Ouais. Bonjour à tous. Est-ce que vous me recevez?
Good morning. Can you hear me?
Je crois qu'il n'en va encore. On laisse comme ça,
Good
non?
morning. Yes, we can hear you. Thank you. We can hear you. Thank you.
Ok.
Bonjour, on
Merci
vous
beaucoup.
entend. 5 sur 5.
Merci beaucoup.
Thank you very much. We can hear you loud and clear.
D'accord.
Donc, qu'est-ce que tu veux que je fasse avec ça? putting templates. You are putting it on the screen now. Yeah.
Good morning to all. We give member states additional 5 minutes to enable those that haven't yet logged in to log in. 5 minutes only, please.
Yeah, we need to unmute. Unmute.
Good morning, Excellencies, ladies and gentlemen. It is with great pleasure that I welcome you to the live forum for candidates for the nomination of the next WHO Regional Director for Africa. I would like to acknowledge the presence of the Acting Regional Director, Dr. Chikwe, with us today. Welcome, Dr. Chikwe. At the first special section of the WHO Regional Committee for Africa, held on 14 January 2025, the Regional Committee agreed to convene this virtual live forum for candidates, in line with the recent practice followed in our region with other regions of the WHO. Let me thank you all for the support given to this initiative and to the Secretariat for its readiness in organizing it. As you know, this is a non-decision-making platform intended to provide an opportunity for candidates to present their experience, expertise, and vision to enable member states to acquaint themselves with the candidates. Participation in the Forum for Candidates is limited to member states of the WHO African region, assisted by a limited number of Secretariat staff. Please note that this Forum for Candidates has interpretation in English, French, and Portuguese, and is being webcast for public viewing on the regional website as well as live stream on social media accounts, YouTube, Facebook, and Twitter. In view of the above, may I please request that you speak at a moderate pace to the convenience of the interpreters. We kindly ask all those in the room to have their phones off in order not to disrupt the conduct of the live forum. Allow me now to turn to the arrangements for the interviews. With the communication of the Secretariat on the 4th March 2025, the Secretariat circulated the arrangements for this meeting. Each candidate is to make a presentation of up to 20 minutes, which will be followed by a question and answer section for an overall duration of up to 40 minutes. May I recall that the detailed proposed arrangement for the interviews are as follows. Turning first to the initial oral presentation, the oral presentation by each candidate is not to exceed 20 minutes. While 20 minutes is allotted for the presentation, candidates may wish to make a presentation of less than 20 minutes in order to leave time for questions and answers. As far as the process for selecting questions is concerned, each member state joining the forum may ask questions if it so wishes. Member states were invited to indicate the candidates they wish to ask questions by writing to the regional office not later than 26 March 2025 at 17 hours Brazzaville time. Tokens bearing the names of all member states which notified the Secretariat that they wish to ask questions were put in relevant receptacles, one for each candidate. Let me remind you that member states that propose a candidate are expected to refrain from asking that candidate a question. After each candidate has made their oral presentation, I will pull the tokens one by one on a random basis until the time available is exhausted. After each token is drawn, the corresponding member state will be invited to ask their question, and the candidate invited to provide an answer. As concerns the procedure for the question and answer section, member states will have up to 1 minute to ask one question only. Please do not divide questions into different parts, such that there is, in effect, more than one question. May I kindly repeat that please do not divide questions into different parts, such that there is, in effect, more than one question. I will ask member states whose lots have been drawn and are therefore provided with the opportunity to ask a question to kindly refrain from posing a question to a candidate which seems identical or substantially similar to the one already addressed to that candidate. I will also ask member states to please have their cameras on and to unmute when giving the floor. Candidates will have up to 3 minutes to respond to each question. Each interview will conclude when 40 minutes have elapsed, even if there are still questions pending. However, a candidate will have to complete the answer to the questions being addressed when 40 minutes have elapsed. Should there be time available after all the tokens have been drawn, I will open the floor to member states that have not yet asked a question to see whether they wish to do so. I will give the floor to member states in the order in which they raise their hand in Zoom. If following this, there is still available time, the candidate may, if he wishes, make additional remarks within the remaining time. Member states connected online and those of us in the room will see a clock on the screen indicating much of the 40 minutes allocated per interview remains. There will also be a clock indicating how much of the 3-minute time limit for responding to each question remains. These will be used to help participants keep within the time limit. Because of the strict time limits, I ask all member states not to interrupt the interview process by taking the floor unless this is on a matter dealing with the conduct of the interview. Please note that in my capacity as moderator of this forum, I may ask you to conclude your question or intervention in case it goes beyond the allotted time. Are there any questions? I see none. Congo, your hand's been raised.
Merci beaucoup.
Thank you very much. I'm trying to turn on the video.
Congo.
Merci, je vous remercie.
Thank you.
Un préalable chercher
at the outset, I'd like to understand why, what measures have been taken, what measures have been taken for this kind of meeting. The regional committee, at the head of the regional committee was entrusted to Congo. So I don't know the new provisions now, because we had your predecessor, the minister who has left. I think it depends on countries, not on individuals. We'd like some clarification on this point. Thank you.
Many thanks, Honorable Minister. Thank you very much from Congo. In response to your questions, I would like to refer the Honorable Minister to the rules of procedure. The election of the Honorable Minister of Congo as chair during the RC 74 was done on a personal basis. And if you look at the rules of procedure, it indicates that if the Honorable Minister, the RC 74 chair, is unable to perform the duty, then it will go to the first vice chairperson. And if the first vice chairperson can't do it, then it goes to the second vice chairperson. So since the Honorable Minister, the RC 74th chair, was unable to continue with this position, in line with the rules of procedure, it goes to the first vice chairperson, which is the Honorable Minister of Liberia. I trust this answers your questions, and I'm willing to have a one-to-one with you to explain that. Thank you very much, Honorable Minister. Thank you.
I therefore take it that there is agreement to follow the proposed modalities. In line with the note verbal sent on 4th March 2025, I propose that the forum continues until 16 hours Brazzaville time, with a short break of half an hour. Following 2 interviews, during which we kindly ask that you remain connected. Is there agreement to proceed in this way? I see no objection. Before proceeding to determine the order of interviews, let me remind you that following the publication of the nominations, Niger informed the Director General of the withdrawal of its proposal. We need to decide in what order the interviews shall be held by drawing lots for the 4 candidates. The order of the interviews will be based on the order in which the names are drawn. I will now proceed to draw the names with the help of the Secretariat. Dr. Michelle Kona Yao. Dr. Mohamed Lami Dramé, proposed by Guinea. Professor Janabi Mohamed Yakub, proposed by the United Republic of Tanzania. Professor Mustafa Mijiyawa, proposed by Tanzania, will be the third. And Professor Mustafa Mijiyawa proposed. And Professor Mustafa Mijiyawa proposed by Toko will be the 4th person to be interviewed. I now kindly ask Dr. Michelle Kona Yao, proposed by Côte d'Ivoire. Kona Yao, proposed by Côte d'Ivoire, prepare to take the floor.
Thank you very much, Madame Chair. Excellence, Madame la Présidente de session.
President Chair of the session, Honorable Ministers, Honorable Representatives of Member States of our region, Acting Regional Director, Dr. Chikwe, dear colleagues. I extend warm greetings to you and express my joy and honor to be here today to represent myself as a candidate and to present my vision for WHO Afro. I also like to commend the outgoing director, Dr. Moiti, for the transformation work that she has done for our region. With your leave, I would like to start my speech in English.
I would like to take a moment to honor the memory of the late regional director, Dr. Faustin Ndugulile from the United Republic of Tanzania. This election process takes place in his memory, and through him, our region must see the emergence of a regional director capable of addressing the challenges that have changed and intensified in recent months. Please let me get back to French. Malgré les progrès significatifs,
in spite of significant progress made from the 60s, major health challenges remain in our region. Among the progress made, outside three, the extension of healthy life expectancy, reduction of infant mortality, hoping that it will go down to 50 for live births by 2030. Of course, but it has to tie in with the objective of the SDGs, that is 25 live births per 1,000. And then the next is the significant progress against communicable diseases, and a great deal of progress has been made against HIV, tuberculosis, and malaria. In spite of these challenges, many states continue to face very high prevalence rates, especially in Southern Africa, which is a epicenter of the epidemic. And then there are also major challenges to improve sustainably the population of the health of our region's populations. Let me cite some of them, some of these challenges. First, the persistence of endemic diseases that overburden our health systems, HIV, tuberculosis. In 2022, Africa represented 75% of malaria in the world and 61% of deaths related to HIV/AIDS. And maternal and infant mortality, which is still high, sometimes twice the global average. Difficulties in implementing universal health coverage and access to primary health care, whereas only 48% of Africans have access to essential services. So our systems, our health systems, depend on external funding. About 40% of external health funding in our region, whereas official development assistance is reducing. That's the problem we are dealing with right now. And we see an uptick in non-communicable diseases with changing lifestyles. By 2030, that could become the main cause of death in our region. The proportion of deaths related to non-communicable diseases is about 37% right now. An increase in health emergencies related to climate change and the appearance of new pathogens, with a 25% increase in epidemics in our region. And we have over 100 major outbreaks that we deal with every year in our region. So in the face of this situation, I'm proposing my region for public health in Africa. My name is Dr. Michel Yao, for the post of Regional Director for Africa. My vision is for an African region in better health, supported by a WHO regional office that responds effectively to the needs of member states. My vision is focused on 4 points. Health systems that are adapted to local contexts, health systems that are effective, innovative, and available, and a health system that provides USC and primary health care, which is a critical element, and a proactive capacity to deal with health emergencies. And then heightened collaboration with all stakeholders. You know, the needs are enormous in our region, and my vision is to work with all stakeholders by making the most leveraging local competencies. So my commitment is to work with health authorities, national health authorities, with partners, and especially with communities, and it's based on 3 building blocks. Interventions based on scientific evidence. With the specificities of each of our countries, we need to promote health in our systems. My commitment is to leverage existing systems, and I commit to facilitating the access of each of our countries to innovations that will profoundly motivate our health systems, an analysis of data for a global approach to public health, because it is just more than accessing curative services. We need to support curative services. We need to support member states in building resilient health systems that are capable of guaranteeing essential services and effectively responding to health emergencies, facilitating the financial viability, which is critical right now, our national health systems, by promoting the optimal use of resources, and effectively collaborating and using innovative alternative mechanisms for funding. So in the light of all of this, I propose 5 priorities. Innovation, 5 priorities. Innovation, ensure universal health coverage, resilient health systems, tackling maternal and infant mortality, reducing the burden of communicable diseases, and non-communicable diseases as well. In terms of research and innovation, the idea is to develop African research in public health for interventions based on evidence, on scientific evidence, facilitating access to innovations, to be able to implement digital health that is integrated into primary health care. My second priority is universal health coverage. We will seek to reinforce UHC by essential services adapted to each country with a foundation on public health. The third priority is building resilient health systems. The idea is to develop systems to cope with public health situations, and especially preventing and responding to health emergencies that each of our countries face. The fourth priority is to tackle maternal and infant mortality. We approach an innovative multi-sectoral approach based on evidence for effective reduction of maternal and infant mortality. This situation is not irreversible, it can be reversed. The fifth priority is to act to reduce the burden of communicable diseases and the upsurge of non-communicable diseases. These are the diseases that affect our health and our finances, our health finances. So we are proposing an integrated, multi-sectoral and preventive approach. Ladies and gentlemen, I am therefore proposing this cross-cutting strategy with a particular focus on WHO staff. Basing myself on the transformation and agenda and the 14th General Program of Work of WHO. This strategic approach is to focus our health systems on scientific evidence to improve our health system. That is essential for new African public health. Local analysis of health determinants will enable us to effectively orient our programs and ensure that they are efficient. So improve the use of technological innovations. This is essentially the step that we should take for our new African public health. And so the idea will be to support our member states in the use of innovations, including artificial intelligence for disease surveillance and organizing health services and responding to emergencies. Support predictable and sustainable financing. That is the key factor right now, and it's topical right now. So the idea is to strengthen the commitment of governments and private partners. It is essential to ensure better value for money, better value for money for our investments, improve advocacy for improvement and increase in funding. If we show that our projects have impact, then we can improve domestic contributions and external support, and all of this in keeping with the Abuja Declaration of raising health expenditure to 15%, depending on the state budget. I will support countries to ensure that this critical factor be achieved. Because we can do a lot more with innovative approaches, we need to innovate. We can use various aspects, and WHO will stand ready by your side, honorable ministers, to support you at these difficult times. My fourth strategic approach is to adopt a holistic approach to health, mobilizing communities and sectors and regional partners. Health is the business of everyone. And the idea also is to work with partners such as Africa CDC and other partners on well-identified priorities and in a holistic manner by looking at aspects such as prevention, protection, and cohesion of health. The fifth strategic approach is improving the organization of health services and motivating national health personnel to avoid migration of the brain drain. You know, it will help us to better structure our services, you know, by orienting our primary healthcare and other levels of our healthcare. And based on the epidemiological profile of each country, staff motivation should be strengthened through innovative actions, such as contextualized training, providing equipment and adequate inputs, incentives developed in collaboration with communities, and of course, WHO will stand with you. The sixth strategic approach is particularly strengthening research, especially in community health, developing situations that are tailored to our local context, and ensuring better follow-up of emerging diseases and other traditional medicine, and consolidate preparation for health emergencies, improving surveillance, and all of these aspects by ensuring an effective management of effective risks. We can anticipate, and the idea here is to support countries based on resilient health systems. To these seven strategic health approaches, there is an essential thing that has to be added. There is the human capital of WHO Afro that needs to be enhanced and structured to better serve you. Strengthen staff motivation and activate the best talent, working closely and transparently with the staff association and with you member states to ensure better representation of our countries and to foster gender parity in the various posts, create an attractive and efficient working environment to optimize the impact of WHO on the continent. And lastly, ladies and gentlemen, I'd like to ensure you of my firm determination to reform our organization to serve you with my training that is adapted and very solid experience. I am a physician trained in community health, and I manage health services, and I have a diploma in health services with over 27 years of experience in public health, 20 of them spent in WHO in various positions. So I'm used to mobilizing resources from donors, establishing partnerships, both in emergencies and both to support health systems in our region. On the basis of that experience, I hope to work with you to build a WHO in Africa that is stronger, more innovative, at the service of African communities, combining health services, curative services, and competent use of local resources and using innovations. Allow me to conclude in English.
The challenges we face in establishing strong health system. Honorable ministers, health authorities, I have also gained valuable insight from communities I met in different places in Biakato, Ituri, province in DRC, while addressing Ebola outbreak, Moyale, Ethiopia, while dealing with cholera, in Anjouan, Comoros, in Ouagadougou, while dealing also with flood, and in other many areas in more than 30 countries. I have also gained valuable experience in revitalizing health system, the example of Central Africa Republic. It is worth mentioning that I learned from the field that it is possible to deliver health services when resources are effectively allocated to priorities in a context of scarcity. Today, more than ever, our region is facing a major crisis. We need a leader ready to act in response to the challenges that countries and the WHO country office is facing. We must continue reforming, innovate, and usher a new era of public health. Without any delay or further learning period, I am ready in this critical moment. I am ready to serve and help you to solve health problems we are facing in our continent in a very optimal way. It is possible to work differently for more impact. Thank you very much. Merci beaucoup. Obrigado. Se foi eleito, prometo aos países lusófonos.
If I am elected, I promise all countries that are Lusophone that I shall begin to speak Portuguese. Thank you very much for joining me in this dream for a better African public health.
Thank you, Dr. Yahoo. We will now continue the interview with questions and answers. I will now pull the first token with the name of the member state which expressed the wish to ask a question to Dr. Yahoo. The Gambia. I will now give the floor to the Gambia to ask their question. Gambia, you have the floor.
Good morning, and thank you, Dr. Michael, for that wonderful presentation. And your points were well noted. And I think these are the realities that we are currently dealing with when it comes to health systems in developing countries. The question we want to ask is based on your approach to tackle non-communicable diseases. Because we know currently we have weak systems, and these diseases are taking a toll on from the young age getting down to the older ones. So what I'm sure that you empower weak health systems to effectively respond to the burden and the complications of NCDs that we are currently facing.
Dr. Yao, you now have the floor. Please ensure you complete your answer within 3 minutes.
Thank you very much, Honorable Delegate. Non-communicable disease will be a major cause of death in the coming years, and it should be our top priority. So as Director Regional, it will be one of my top priority, and I will ensure that at least support is providing to countries for a better understanding of the situation. Let us try to understand what are the root causes of the increasing number of, for example, cardiovascular disease, cancer, and so on. Each country may have its specificity. So first of all, supporting research for a better understanding of the determinant of the cause of this is critical. And this is one of the role of the WHO as a technical agency, to back you up to do all this kind of research for a better understanding. The second thing is that learning more should help us at least to anticipate and to understand that what is the trend and how can we restructure our health system. It includes training better our health workers. It includes designing better the offer of services, because this disease are even beyond the urban area, they move into rural area. So the design of our services should take into account this approach based on a better understanding of the trend. And how best can we then equip? How best also can we make available the medicines that are required to deal with this kind of disease? So as a regional director, I will make sure that WHO in each of the countries support you to understand, to redesign the health services, and to make sure that people are trained, that you have the appropriate equipment, but also we have appropriate resource allocation.
Ask the question. Seychelles. Seychelles. Seychelles, are you there?
Thank you. Thank you, Madam Chair.
Yes, please go ahead.
Can you hear us?
Yes. Please
go ahead. Can you hear us?
Yes. We are hearing you, Seychelles.
I would like to ask you what your ideas are, Doctor, with regards to the health in small insular island development countries where the status of health is not the same as in other regional member countries. So what are your ideas for the regional member countries? So what are your ideas for the small island developing states in Africa? Thank you very much, Honourable Representative of Cape Verde. Island nations have specific characteristics. They're having to deal with climate-related impacts. There is an increase in emergencies, in vector-borne diseases. I know that in Cape Verde, malaria has been eliminated, but there are issues to do with dengue, Zika, among other diseases. In these countries, we've also seen an increase in non-communicable diseases, which need to be controlled. My approach, well, my vision has to do with adapting the response, the technical response to each country. We need to ensure that we have a better understanding of the health situation and provide context-based programs for each case. We need to map the specific risks, especially those that are climate-related, and we need to monitor these countries, train the technical staff, provide inputs and supplies that will allow us to deal with these emergencies, and organize a system that will be resistant to the vagaries of the climate. We need health infrastructure, health structures that are specific to the needs of these countries that will allow them to also resist the vagaries of the climate that are linked to climate change. And we will also need to help these countries adapt better to climate change in order to deal with non-communicable diseases and strengthen their systems. I know that in certain countries there are a number of different islands, and some of the most distant islands are of particular concern. So we need to also focus on service provision in these regions. These may be mobile service provision in these regions. These may be mobile services, so that each island has access to health services and thereby improve universal coverage. So these countries will be a priority, but we will have a specific approach tailored to their specific needs, whether this be provision of services or also thanks to the technical support of the different health ministries. Thank you. I thank you.
I shall now give the floor to South Africa to ask the question.
Thank you, Chair of the session. Thank you, Dr. Yao, for your presentation. Our question is, you have said in your presentation that WHO is a normative organization. And you did mention something about artificial intelligence in your presentation. We would like to know how you envisage leveraging technological advances in terms of digital health and artificial intelligence to advance research, enhance surveillance, and consideration for the One Health approach, improving public responses to public health emergencies, and also accelerating progress towards universal health coverage. Crucially, how will you ensure that these technological advances adhere to ethical guidelines and contribute to development of robust, regionally relevant norms, and it promotes equitable access across the Africa region? I thank you.
Dr. Yao, you now have the floor.
Thank you very much, Madam Chair, and thank you very much, Honorable Representative of South Africa. We can't afford to move on a new public health in Africa without using new technologies, because there is a lot of advantages of doing so. It's why one of my first things that I will do in my first 100 days, if I'm elected, is to pull together a forum that will come out with a clear roadmap on how to support the countries. It will help us to define the strategic approach, how these technologies and others can be better used. One of them is surveillance. I'm involved in dealing with many crises. The accuracy of information improves when you use technology. In remote places, using a mobile phone can help us and speed up the response by reporting cases. Using artificial intelligence can help us also to deal with the non-communicable disease. If we afford to have a medical record, electronic medical record in each of the countries, it will help us to understand the trend. It will help us to understand what are the main causes that are specific to each country. It could be related to nutrition behavior or maybe not exercising, but having a file of medical record, electronic medical record using artificial intelligence will help us to speed up the understanding and design appropriate strategy to deal with these issues. We can also use technology to improve access, like telemedicine. In many diseases, like even tropical neglected diseases and non-communicable diseases, access remain issue. Dealing with child and maternal mortality, access remain also an issue. Telemedicine can improve this access, mainly in rural areas where this is a challenge. And of course, WHO will support you, working closely with different stakeholders to set up clear rules. The other part that you mentioned before ending is about One Health. Of course, using technology can speed up the understanding the cross-cutting issues, and the multisectorial need of interventions for all different diseases. So technology innovation should be critical for us to reduce costs, but also to improve accessibility of health services. Thank you very much, Honorable Representative.
I shall now give the floor to Malawi to ask the question. Malawi, the floor is all yours. Zambia. Zambia. I shall now give the floor to Cameroon to ask the question. Cameroon.
Madame la Présidente, passe la parole. Madame la Présidente, passe la parole. Le Cameroun n'a pas de question pour l'instant.
For the time being, Cameroon does not have a question. Thank you. Thank you.
I shall now give the floor to Mauritania to ask the question.
Bonjour. Bonjour.
Good afternoon. Good morning. Good morning.
Bonjour.
Good morning.
Morning. Good morning.
Bonjour, docteur.
Good morning, Dr. Yao. My question is as follows. In a context where we have seen an increase in communicable and non-communicable diseases, given the growing scarcity of financial resources, especially in our region, and given the significant climate change underway, what strategy do you envisage to help countries deal with this state of affairs? Thank you. Thank you very much, Honorable Representative of Mauritania. As I had indicated in my initial presentation, communicable diseases are a significant burden. So let's think about working on prevention and promotion of health. Of course, this has an impact in economic terms. Of course, the context is also of concern because of the reduction in the financial support with regards to certain programs. And ODA, we have programs to do with malaria, HIV, vaccination programs as well that have seen a decrease in funds. We're talking in some cases about 30% of the funds required for HIV responses. So my strategy will be to assist countries to better understand the determinants of these diseases so that we can focus our action on better health and on prevention. We'll need to improve the health services being provided. We also need to mobilize domestic financial resources. As ministers, you will have to assist us by showing us the link between investment and impact in your presentation of the different case studies. This will be imperative. We'll have to look at the different commitments of the different countries under Abuja and other commitments, and focus on initiatives that have true impact. We'll need to mobilize partners based on priorities identified by you so that we can reduce the burden of these diseases, promote better training of staff, and also produce inputs and supplies locally. This is one of the significant priorities post-COVID. We will need to assist you in finding a way to provide lower cost inputs through a grouped procurement, pooled procurement in our region so that we can bring down costs. We will also support you in managing emergencies, strengthening cooperation, strengthening surveillance, strengthening training of emergency teams, and ensuring that inputs are pre-positioned based on the risks for each country. And we will also have an early warning program in place. So we will stand next to you as WHO across all these areas, mobilization of external resources, domestic resources, mobilizing resilient systems to help prevent all of these diseases. Thank you.
Can I respectfully ask you to respect the time? Thank you. We have the last question from the member state, and it's from Zimbabwe. Zimbabwe, the floor is yours. Zimbabwe.
Thank you, Chair. Thank you, Dr. Nda. Thank you for the presentation. My question is on addressing challenges involving infrastructure. What strategy would you implement to address the weaknesses in health infrastructure in many African countries?
Thank you very much, Honorable Minister, representative of Zimbabwe. Indeed, in many of our countries, infrastructure remains one of the critical aspects in providing services that increase access. And to do so, as I mentioned earlier, is to have also a clear understanding of what are the gaps. So WHO will stand ready behind you to ensure that at least we can monitor. I recall that when I was in Central African Republic, I was doing the health resource and service availability mapping every year. It helped us at least to identify what are the red zones, where the priorities should go for investment from government as well as investment coming from all the stakeholders. So WHO technical role, showing that you can clearly identify this gap and what is required to deal with them is critical. It's one of the first steps for internal resource mobilization as well as also external resource mobilization. The other critical aspect when we have this infrastructure is about maintenance. So is to make sure that we work closely with countries so that we can design curriculum and training for technicians that can ensure this maintenance. We buy equipment and then after the first break, we can't use them anymore. So as WHO is still stand behind you to make sure that we can map, that we can mobilize partners, that also we can fill critical gaps, supporting training, supporting procurement, and all these critical aspects is true for response for the normal program as well as response to emergencies. So I would like to thank you. Thank you very much.
The total time for this interview has been exhausted. Thank you very much, Dr. Yao, for being with us today.
Thank you very much.
We now proceed with the interview of Dr. Mohamed Janabi from Guinea. Thank you, Dr. Mohamed, for joining this forum today. May I now ask the Secretary to ensure that Dr. Mohamed is ready to take the floor? Please proceed with your oral presentation for up to 20 minutes. You have the floor, Professor. Doctor.
Thank you all. First of all, I would like to say, are you hearing me? Okay.
Yes, we are hearing you.
Okay, are you hearing me?
Yes, please.
Okay, thank you. First of all, I would like to say that I will make most of my statement in French. I will, however, give this introduction and the conclusion of my declaration in English and Portuguese. The other working languages of our region that I have been using throughout my career. Excellencies, Ministers of Health, distinguished representatives of WHO member states, dear colleagues and partners, I would like to thank you for giving me the opportunity to formally ask for your support and backing my candidacy for the honorable position of WHO Regional Director for Africa, for which I humbly invite you to select me. Excellencies, Senores
Excellencies, Ministers of Health, honorable representatives of WHO member states, dear colleagues, dear partners, allow me to thank you for giving me this opportunity to formally request your support, your backing of my candidacy to the venerable position of Regional Director of WHO Afro. I ask you humbly to choose me.
I remain convinced that Africa has the requisite resources and potential to overcome the public health challenges. For over 3 decades, I have been working throughout the region and in all the linguistic zones of Africa, and this has given me an in-depth understanding of the health realities. I've had the honor of collaborating with communities, governments, partner organizations as well, and I've noted to what extent the health systems have evolved, even though there's still challenges to be addressed. I would like to acknowledge and laud the work that has been done during her mandate as the Regional Director of the WHO Office for Africa. We have witnessed significant progress in the fight against infectious diseases, the improvement of maternal and infant health, and more robust health systems. However, despite this progress, the health indicators of African populations remain of grave concern, and this needs or requires us to step up efforts to look at the epidemiological and environmental trends in our region. Unfortunately, the death of Dr. Faustin Ndugulile, the regional director, robbed us of his experience. It's really sad. However, he left an excellent program on which we can build. This ambitious program is a solid basis for our action. Given the new emerging challenges, and this includes the withdrawal of the US from the WHO and its assistance, as we need to reconsider our approach with our financial partners and seek sustainable solutions. It is our opportunity to take our fate in our hands. We need to reorganize ourselves and to progress towards UHC by finding adapted national solutions. I would like to propose in this regard a strategic proposal for a dynamic Africa. Africa has the necessary resources, technical and human, to address the challenges. For over 35 years, I've visited a continent and I've understood the expectations of the African health systems. We need to transform the current constraints, including instability, geopolitical instability, financial pressure, the climate crisis, into positive actions. And I believe that the solutions can be found within Africa, as well as Asia, Middle East, and the Latin America continent. And this can give us additional context to resolve what's happening in Africa. I have a multi-sectoral, bring on board multi-sectoral experience and innovation. Ladies and gentlemen, let me share my vision with you for the next 5 years if elected as regional director of the WHO Africa region. I am thinking about change, and I come up with some good strategies. We need to ensure that primary health care is the foundation of universal health coverage. I commit to ensure that PHC will be accessible, digitized, and adapted to local realities. This is indispensable to attain universal health coverage and respond to the legitimate concerns of the population, both in the urban and rural areas. And we need to therefore fast-track our work through the renewal of primary health care and commit ourselves more to ensure that we have innovative financing solutions to guarantee equity as well as inclusion of all segments of society. Secondly, we need to invest in human resources. We need to ensure that the African consensus on sustainable development is operationalized. We need to retain health personnel in areas that are suffering. We need to invest in health personnel based on the African Charter for a skilled workforce. Thirdly, we need to build resilient health systems and ensure that there are basic services. When we have climate and humanitarian crisis, we require robust health systems to ensure the continuity of services even during crisis situations. I would defend the protection of health personnel and build the operational capacity of countries to prevent such difficult situations. I would build health infrastructure, particularly in the rural areas. I would invest in digitized systems of health systems and e-health, as well as a regional framework for artificial intelligence. I would contribute to strengthening rapid detection and response systems, and I'd do this in collaboration with Africa's CDC. I would include climate concerns as we manage various diseases. Fourthly, we need a new deal for financing health in Africa. Have seen a drop in finances. We are now at $25 billion of support, and yet we are faced with a huge crisis of epidemics. 30% of health expenditure comes from overseas development assistance, and this therefore is having a great impact on the continent. The programs that have been most affected by the US's withdrawal are those related to infant health, HIV, AIDS, and emergency preparedness. The reduction of overseas or official development aid then are impeding the reduction of the maternal mortality rate and the infant mortality rate. The WHO indicated at the beginning of this week that 5 countries of our continent will be lacking antiretroviral drugs for HIV in the next coming months, given the withdrawal of funding. And a Lancet report predicts that in low-income, intermediary, and middle-income countries, we will have consequences because of PEPFAR's removal. And Africa is the continent that will be most affected. The African health response is also linked to the debt service of countries. And we cannot forget what is happening in the various sectors within countries. It is therefore time to rethink our financing model, and I would propose a strategy based on public-private engagement and international solidarity to have a development investment. We need innovative and transparent mechanisms to ensure that we have health coverage on the continent. We need innovation for health systems and mixed funding. I would propose a strategy that would help the health sector, that would help us get at least $95 billion from the diaspora, including the possibility, if you will allow me, to have some levies imposed to get these funds. The investment of the private sector is really important for electrification, connectivity, infrastructure, supply chains, etc. I would conduct active health diplomacy in this regard to reposition Africa so that it is one of the priorities in global funding. The external aid crisis we are facing is an opportunity for Africa, and I would like to propose to you, member states, as well as developing partners, to organize an African conference in collaboration with the African Union on investment and cooperation for health. Fifthly, and very important, we need to talk about the transformative governance and accountability. I would like exemplary regional governance that is transparent and focused on resources. This requires good M&E systems, rigorous budget management, and strategic dialogue with member states. This reform would help us recenter the WHO Africa region on priority areas. And sixthly and lastly, we need contextualized and quality technical assistance. I would develop more flexible and targeted assistance that is adapted to local realities. This will be done with budgetary rigor. We need to use local competencies, tap into regional synergies, and promote research and innovation in Africa through more innovation. I would now like to explain why you can count on me to deliver this agenda. My career and my experience would be to the service of Africa. My career spanning 35 years in public health has given me good expertise at international level. I've worked in various contexts, both in Africa and globally, and this has enabled me, developed a global vision and contextualized health. My technical expertise and studies. I have a master's in public health. I have a PhD as well from the University of Havana. I also have a degree in health diplomacy. I have been working on the ground. I've been managing programs right from the clinic to the districts, regions, and national level. And I've also worked at policy level, worked with ministers in cabinets as well as institutions. My field experience has been strengthened throughout Africa, but also my academic activities in Africa and elsewhere. My career has given me a broad knowledge of the terrain regarding health. I have worked throughout the region, as I've mentioned previously, and I understand the local realities. And I have a good network with governments, partner associations, and opinion leaders in the health sector. Over the years, I've had good networks and partnerships in Africa globally. I have trustworthy relationships with researchers, representatives on international organizations, which would enable me mobilize resources and tap into varied expertise. We need collaboration between Afro and the HQ. I would like to ensure that country offices as well as the regional office and HQ work in tandem. My career has enabled me to understand the subtleties of African governments as well as international partners.
I do believe it's time for action to strengthen our national health system for better health of our population. The system for better health of our population. In Portuguese, estou preparado.
I am ready. I am prepared to place myself at your service with determination, with humility. At this crucial time of historical transformation, seeking to strengthen WHO's protagonism in public health. If you vote in me, you're voting in experience. You will be voting for leadership in defense of better health in Africa, for sustainable human development. Thank you.
Thank you.
Thank you, Dr. Mohamed. We will now continue the interview with questions and answers. I will now pull the first token with the name of the regional committee member which expressed the wish to ask a question. Saitome and Principal. Saitome. I shall now give the floor to a member state to ask the question. The Gambia. I shall now the Gambia. The Gambia, the floor is all yours. I shall now give the floor to Burkina Faso.
And thank you, Madam Chair. Bonjour, Dr. Dramé.
Good morning, Dr. Drame. Good morning. I'd like to ask you a question on resource mobilization. I know you've mentioned a few things in your presentation, but I'd like to concretely understand how you will do this given the challenges and the withdrawal of important partners. How do you intend to mobilize resources and prioritize them given that the majority of countries in the Africa region have limited resources? Thank you.
Merci beaucoup, Madame.
Thank you very much, Madam, the representative of Burkina Faso. Your question is very relevant and crucial. I spoke a little bit about it, and I would like to just reiterate what I said. I am convinced that we have limited resources, but we still have domestic resources. I would discuss with countries, as I indicated, on how to mobilize domestic or national resources. That is the first thing. We are all aware about the budgeting process in various countries, and through the ministries of finance, sectors come with the priorities, and we can assist countries to develop a health policy dialogue where health would be at the center of national priorities, and national priorities mean that we would have health included through various channels. We will have discussions with various organizations, both national and international, and networks that we've built so that the African private sector can play a lead role. I've had me to give you all that experience, but then given what I've seen in various African countries, the African diaspora remits $95 billion to Africa annually, and we need to tap into those resources. Now, vis-à-vis our technical and financial partners, we need to show through our international initiatives, banks, organizations, we need to put in place strategies and viable financial plans with concrete proposals, concrete diplomacy. Why is it that billionaires in Africa cannot create funds in their name so that we can mobilize with their support the funds for health? That's an idea. Thank you.
Yeah. Soko, you have the floor.
Merci, Madame la Présidente.
Thank you, Madam Chairperson. I would like to thank Dr. Drame for his presentation. I'd like to ask the following question to Dr. Drame. Beyond epidemics that are linked to infectious diseases, we have a huge burden in hospital mortality rates because of the almost inexistence of surgical materials and equipment. If you are elected the regional director for WHO Africa region, how do you plan to support countries in the region? Thank you. Thank you, Madam Representative of the Republic of Togo, for that very interesting question. We know that the hospital is an emblematic institution of our services, and the hospitals cannot resolve all challenges. You can only get solutions when you have functional hospitals. We know that some diseases and the ones that are most deadly happen when you have emergency situations. So we need to equip our hospitals to
that all the partners, when they intervene, it should be on the basis of consultation. They should work together. For instance, we cannot imagine regular to the National Health Development Plan that has been adopted. That will avoid duplication. And that will enable us to be more efficient. Now, at the continental level, a while ago, I said that the African region and Africa CDC, whose first board of administration I headed, should work together in a concerted and coordinated manner and make us more efficient. It should also be noted that the two principals, that is Dr. Moiti and Dr. Kasela, we realize that there is greater coordination so that these two continental bodies are not dueling together, but working as partners. They work in synergy. So that is the answer I can provide to your question. Thank you, Professor.
I shall now give the floor to the Gambia to ask the question. Gambia, are you there? The Gambia, can you kindly ask your question? If you are muted, please unmute yourself.
Okay, thank you very much, Madam Chair, and your brother out there. As a continent, we have this current issue of procurement of relevant drugs, more so in our part of Africa. Sometimes this has to do with the volume, for individual countries. Do you have any plans in place, to see how this could be eased, for most of us?
Merci à mon frère.
Thank you very much, brother from Gambia. The question you ask is both crucial and pertinent, and we've experienced it. We experienced it during COVID-19. And that is where the opportunity arose for grouped procurement, grouped ordering of medicines. Of course, each of our countries is of a different size, has a different sized population, and individually we don't carry much weight, which is why we need grouped procurement that makes things more fluid and makes medicines less expensive. We saw this in the initiatives that were undertaken by our heads of state. We saw this under COVID-19, and that is the road to follow. This is also true when we think about setting up local production units. In other words, we need to have regional hubs. We can't imagine that every individual country will be manufacturing goods for itself. We'll need regional hubs, and that means we'll need to place grouped orders, opt for group procurement. That will improve matters and will improve the volume of our orders and reduce costs. So I think that is an outline of what we will do in terms of buying medical products and medicines. We can also note that collaboration with Africa's CDC was of the essence during COVID-19. And so we will draw lessons from that experience and look ahead, seeking to strengthen our group procurement efforts, which doesn't in any way undermine the principle of sovereignty of each of our individual countries. Thank you.
I shall now give the floor to Zimbabwe to ask the question.
Thank you, Chair. Thank you, Professor Mustafa. With the withdrawal of 18% from financial support to WHO, how do you envision the role of WHO in Africa evolving over the next 5 years? Thank you.
Professor Mustafa.
Oui, merci à mon frère.
Thank you very much to my brother from Zimbabwe. It's true that financing is very important. It's one of the pillars of our health system, and it's also true that we're crossing a particularly different period in time with certain important partners withdrawing. The first thing we'll need to do is focus on advocacy in our countries to increase, to bolster health financing. And when I say funding health or financing health, that isn't simply looking at the monies allocated to the health ministry. I'm thinking about all health determinants that have an impact on health. Of course, in many of our countries, water stewardship is different. It doesn't sit in our health ministries, and we know that a significant parcel of our population doesn't have access to drinking water. So when we look at financing for drinking water, this has to be encouraged by the health ministry as well. And so there is the money allocated by the state. There's also innovative financing to consider. I propose that we add cosmetic products to the list that we are already familiar with, products that are taxed. And we also need sound management, strict management. The fewer resources we have, the more rigorous, the stricter we need to be. And I was talking earlier about our partners. There is need for coordinated action on the part of ministries so that we have greater energies, greater efficacy in all our actions. And often when we talk about financing and resources, we think about inflows, but sound management is fundamental if we're to increase the resources available. And it also allows us to be more efficient. The current situation is going to encourage us even more to look inwards and to count on ourselves, first and foremost. And this is the kind of advocacy I hope to lead if I have that role, working with the different authorities in the different countries. We also need, as I've said, and I repeat, good management to motivate the different partners. Thank you very much.
I shall now give the floor to Ghana to ask the question. Ghana, are you there? Kindly unmute yourself. Ghana, are you there? Are you ready? If not, I will ask another member state. Uganda. I will now give the floor to Uganda to ask the question.
Did you say Uganda? Chair, I hope you can hear me. Thank you, Professor Mustafa. My question.
No, Uganda, we are not getting you. Can you restate your question? No. Uganda, there are some challenges. Can we call you later?
Offices for enhanced support to the countries.
Did we say Ghana or Uganda?
Uganda, can you repeat your question? Uganda.
Okay.
Okay, Uganda. Thank you, Professor Mustafa. Given the dwindling resources, the question is, how do you propose to strengthen WHO country offices to enhance their support to the countries?
Merci.
Thank you. My brother from Uganda. How to strengthen country offices? That's a very interesting question. And it underpins one of the transformation concerns of WHO. The first thing will be to take into account the specific needs of each country. And very often WHO support is technical in nature. We saw this in Togo when we had to deal with epidemics. We were able to collaborate with the country office of WHO, and based on the needs identified, WHO the national team. Similarly, also through WHO, we benefited from advice and tools, namely equipment adjusted to the needs in the country. So, in other words, it's WHO that's mobilizing staff and expert knowledge, and that allows us to support where support is needed. That, of course, requires the coordination I spoke of earlier and the contribution and support of the different partners. Our country offices should be set up in such a way that they are country-specific, adapted to the country. We can't have one-size-fits-all model. But this means that the Ministry of Health of the country will need to coordinate closely with the national representative of the WHO in order to identify needs as required, and so that the WHO can then propose how it can contribute, how it can support the country. At the same time, other partners who may also have contributions to make to resolve a given problem, those partners need to also liaise with the national WHO teams so that there's coordinated, concerted, and efficient action. Thank you.
The total time for the interview has been exhausted. Thank you very much, Professor Mustafa, for being with us today. And this concludes the live forum for candidates for the WHO Regional Director for Africa. I would like to thank all member states of the WHO region and the candidates for having joined this forum today. We had a rich exchange, which will be valuable to member states in their assessment. I also personally want to extend my thanks and appreciation to the RD, Dr. Chikwe, for the hospitality that's been provided in the environment for us to have this forum. I'd like to thank the Secretariat for organizing it, and I can assure you that the member states in May will make the best election. I wish you all a good day and look forward to seeing you in person in Geneva on the 18th of May, 2025 for the second special section of WHO Regional Committee for Africa. There's a saying that you leave the best for the last. So permit me to introduce myself. I'm Dr. Louis Maple-Koto, and I'm the Minister of Health of Liberia. I served as the second vice chair for RC 74, and currently I chair this section for and on behalf of the member states. Thank you for having me as your chair.
Thank you.
Yeah.
Merci.
So I hereby, with the power vested in me by the regional director, declare this section closed.
Thank you very much.
Merci beaucoup. Merci, thank you. Obrigado.
Good luck, everyone. Good luck. See you.
See you.